update for Simcoe, Muskoka. As of today, we have a total of 607 cases. This is up 9 cases from when I last reported a week ago on June the 30th. Over the weekend till Monday, we had 5 of those cases, and from yesterday, we had no additional cases. If we look at the cases, 2 are female, 3 are male. They range from their 20s to their 90s. All of them reside in Simcoe County. All are sporadic cases, not associated with an outbreak. 1 is a community acquired, 1 is a close contact of a case, and 3 are under investigation. 2 of those cases had no symptoms or picked up with screening style testing. So if we look at the trend of cases, we are down quite dramatically compared with the preceding 3 weeks. So during the week of June the 28th, we had a total of 10 cases. 1 of these was associated with a workplace outbreak. The week before that, the week of June the 21st, we had 40 cases. The week before that, June the 14th, we had 40 cases. The week before that, June the 7th, we had 26 cases. And the week before that, May the 31st, we had 19 cases. So basically, we've gone through a resurgence of cases, which appears to have come to an end, at least for the time being. Which certainly not a good thing that we had the resurgence of cases, but a good thing that it appears to be ending. Of course, all of that speaks to the importance of everybody maintaining their control measures, maintaining the physical distancing, maintaining hand washing, and use of masks if you're in indoor public places. And I'll be speaking shortly about an announcement that I have to make with regards to that in Simcoe, Muskoka. And of course, people should be self-monitoring and isolating if you develop any symptoms and seeking assessment and testing. All of that's really critically important to avoid another surge of cases and to keep the curve on a downward trajectory. So some more good news. We've had 2 institutional outbreaks now declared over. One was at Simcoe Manor and the other was at Stainer Care. Both of them were limited to a single case. In the case of Simcoe Manor, 1 resident case. In the case of Stainer Care, 1 staff case. So with that, we now have no institutional outbreaks in Simcoe, Muskoka. So that's for the first time in many, many weeks that we have not had any institutional outbreaks. We do, of course, need to keep up our vigilance to avoid that kind of thing happening again in the future. We have 1 remaining workplace outbreak. It was declared on June the 28th in a food processing plant in Simcoe County. There have been 16 workers who've been cases associated with this outbreak. 14 of those live in Simcoe, Muskoka, and 2 live out of residence, and so those 2 wouldn't be counted in our case count. They would be counted in the case count of the health units that they reside in. So we've had a total of 538 cases recover, so that's 89% of our cases have recovered. 3 are presently in hospital, none are in the intensive care unit, and we have 27 individuals who are self-isolated and recovering at home. We've had no additional deaths, so a total of 36 deaths. The last death was on May the 16th, so it's been a long time now since we've had a death. So on the whole, we're doing much better than we had for quite a while. In terms of our trajectory, the reproductive number, the number that indicates whether or not cases are growing or shrinking, is less than 1. So anything less than 1 means that we're shrinking, that we're getting less and less in the way of cases. And at the present rate of cases coming in, it would take a total of 9 months to double the number of cases that we have. So that's, the longer the time period, the better. That's the longest duration we've had. So definitely positive numbers overall. I'd already identified the last time I spoke that we have had a shift to young people being more affected than they were earlier. So that that's not new information for you. And I'd also identified that we've had a shift towards asymptomatic cases being more prevalent among the total of cases that we've had. So that's not new information for you either. So at this point, I'm going to work through the issues that arise. There's one question that's been raised by the media, and that is as follows. We've heard suggestion locally that some people who tested positive in Muskoka and have remained here are recovering but have a home elsewhere and aren't having their positive status shared with the health unit by their home health unit. Is there any truth to this, and therefore the possibility that there are cases that haven't been reported here? So in checking with my staff, we feel this is unlikely. Possible, but not likely, because it's a practice among health units to inform the other health units of cases that have moved into their area. And certainly if there were any contacts associated with such cases in our district, those health units would inform us of that so that we could follow up with them. So possible, but we don't think it's likely. So I shall now proceed with my announcement with regards to the use of face coverings or masks in the community. As you know, for a very long time now, for some 3 months, I have been actively promoting all of the control measures that we need to be doing to flatten the curve. The physical distancing of 2 meters from other people, the hand washing, self-monitoring if you develop any symptoms, self-isolation, and getting tested. And I've also spoken to the importance of wearing a mask when you're in an indoor location in which you cannot physically distance from other people, such as if you're shopping or if you are on transit, possibly also in outdoor locations if you find yourself in a crowded location, such as during protests. The reason for this is because there's some evidence showing that you can reduce the likelihood of spreading to other people if you wear a cloth mask, if you wear a face covering of some kind. There's increasing evidence, ecological in nature, looking at different countries and comparing how they've done with COVID-19 that suggests that if we have a very high coverage or participation rate of use of masks like this, if we can get 80% of the population or more wearing a mask when they're in crowded locations, indoor locations, we can reduce the spread of COVID-19 and help to prevent a resurgence from happening, a new wave from happening. That, along with all the other control measures that I always cite. If we do these things well, we can reduce the likelihood of it coming back. And we've seen some very frightening resurgences happening in different places in the world where they've relaxed the control measures, most notably right now in the southern United States, where they're having, in a number of those states, a tremendous increase in the cases, growth of cases, putting them back to square one before they tried to control it in the first place. And certainly I think this has made us aware that the danger lurks. It's still there. The potential is still there. With the few cases that we have here, they could act as seeds to germinate a new surge if we're not on our guard and if we're not careful and if we're not putting in place what we need to put in place to prevent that from happening again. And we've even had a bit of a local surge over the last 4 weeks that has just been brought to an end. So as we open up the economy in Ontario, there is greater potential for such spread. There's a potential for people coming in contact with each other in close confines, even if they are doing their best to physically distance. If that becomes compromised, they'll need added protection. They'll need to protect those around them in the case of a cloth mask. We know that surgical masks... I'm sorry, I hear an echo. If people could mute, that would be great. We know that surgical masks are still in short supply, need to be reserved for healthcare. The medical masks need to be retained for that purpose. So what we're really talking about now is people's homemade cloth masks or cloth masks that they can obtain, purchase in the community that are becoming more available, or the use of other face coverings is a possibility as well, whether it's a bandana or a hijab or niqab or a buff. Something to cover the nose and the mouth. You need to cover both the nose and the mouth. If you let the mouth, if you leave the nose exposed, then you're really not achieving any benefit. You're still potentially spreading to other people. So when I wear a mask like that in the community, I'm protecting you. And when you wear a mask like that in the community, you're protecting me and other people. If we both do it, if we all do that together, we can reduce the risk for everybody. It's been commented to me, and I've noted myself, that we appear to be relaxing about these things. For one, there appear to be more people congregating in larger numbers than should be happening. By my observations, it appears that people aren't using masks as much or quite as careful about physical distancing as much in retail settings. We have seen over the past 3 weeks a number of health units and municipalities that have put in place some kind of control measure to require the use of face coverings or masks in indoor public place settings to achieve this added degree of protection. This started in Wellington, Dufferin, Guelph with an order from the local medical officer of health and has been put in place by some other medical officers of health using the Health Protection and Promotion Act, Section 22 of that act, an order from the medical officer of health. And we've seen other municipalities in which the medical officer of health has made the case to the municipality to put in place a bylaw to achieve the same end. And so this took place Tuesday of last week in Toronto, where the medical officer of health there made the case to the Board of Health for Toronto and Toronto City Council to put in place a bylaw requiring a face covering in this kind of way, and succeeded. So Toronto has put that in place, and it is now enacted. Since that time, I've seen my colleagues in different parts of the province come forward with their municipalities with a variety of approaches, including most recently the use of the Emergency Management and Civil Protection Act. There is a regulation in that act that cites that the medical officer of health can give direction to owners of businesses and organizations to require infection control practices. And that now has been used by some medical officers of health as direction to those operators of those facilities to have a policy in place requiring everybody in those institutions, in the public spaces of those institutions, to use a face covering or a mask. The largest number of health units I'm aware of having done this is those in Eastern Ontario. We've got a total of 4 health units that with their municipalities went in this direction as of yesterday, and effective immediately as of yesterday. Some of these approaches have been effective immediately. Some of them have been delayed by up to a week for implementation. And so my municipality CAOs, Chief Administrative Officers for the municipalities in Simcoe, Muskoka, have been communicating with me. I met with them last Thursday about this question, and I received quite strong support for them seeking my leadership on this whole question of what to do about the question of mandatory face covering use, and said that they would be very willing to support me in my decision. We talked about logistical matters such as enforcement and such, but on the whole, it was a strong support to act in some way. And the municipal politicians, leaders in the District of Muskoka, were very interested in the position I was going to take, because they were considering whether or not they would put in place a bylaw themselves or a motion of some kind on this matter. So I met with them yesterday at council and spoke to them about the topic in general, alluding to the fact that I'd be making an announcement today. So I've also received communication from some physicians who want to take local leadership on this question, want to take a strong promotional position about mask use and making masks more available to people, seeing very much the value of it. To be completely disclosing, I've heard from one physician who was also opposed on the basis of concerns about the potential downsides of mask use, citing evidence primarily from medical mask research. So I've heard mostly support, some opposition to the idea that this be done in a mandatory fashion. In my role, must lead on such questions. And so, as of today, I have communicated in writing to the businesses, the operators of the businesses, and organizations, indicating that I'm providing them with direction under the Emergency Management and Civil Protection Act, requiring that they have a policy in place that would require that all people within the portion of their premises that is public require that they wear a face covering or a mask in order to address the concerns that I have walked through with you now, and the potential to further protect the population and avoid a resurgence happening. And I've also made that known to the municipal councils and the CAOs for Simcoe, Muskoka, asking if they could further forward our letter to make sure that we get to them all. And we're putting this information up on our website, which should be available to viewers right now, along with other resources to support my direction to these premises. In this order, we note that we want a best effort and we want goodwill in the implementation of this. And so although they are to raise with people who come into their premises this direction from myself and to encourage people to wear a mask, we're not actually going as far as to say that we absolutely require them to prohibit people from remaining on their premises or coming on their premises. We're taking a slightly softer approach or step with this. We're hopeful that this would be enough to achieve a high degree of compliance. We're looking for above 80%, in keeping with what the research shows would be effective. And we've added other content as well. We've reminded them of the other control measures that are needed, that we need in these premises, reminders and enablers for people to physically distance 2 meters, and we need in place the ability for people to sanitize their hands with the provision of hand sanitizer. And we're also requiring them to have their staff trained on such and prepared for such, and that their staff, when they're working in these environments where the public is available, is accessible, should also be wearing a mask. There are certain exceptions to all of this. So for employees that are working behind a sufficient barrier, such as plexiglass or glass, that they would not have to wear a mask, provided that it is sufficient. If it's not sufficient, if it isn't completely protective, if it allows for people to kind of work around the side of it and then be in close contact with such employees, then in fact we'd be wanting them to be wearing a mask as well. If for members of the public, if people have medical conditions that would preclude them from wearing a mask, they wouldn't be wearing a mask. If you're talking about children who are under the age of 2, they should not be wearing a mask. If they're above the age of 2, between 2 and 5, and aren't able to manage it, they're not to be wearing a mask. And if people have religious reasons, faith-based reasons for not wearing a mask, and then would not be wearing a mask. We've also given exemptions for school environments and for childcare environments and for day camps. And the reason for that is there are already provincial protocols in place for them. And so we want to continue working with those protocols instead of applying this to those environments. We've been asked the question about face shields instead of the use of masks. Is kind of clear coverings of the face, and our response to that, having consulted with Public Health Ontario, is that the evidence for that is not there. It's not consistent or not clear enough. There's not enough evidence to show that it's sufficiently protective to be a substitute for wearing a mask. So we aren't going to be allowing that as a substitute across the board. Now, of course, a person could wear that with a mask for added protection. They are used in healthcare to protect splashes to the eyes, as is the primary purpose for them. So a person could wear them in addition to a mask, or if you have an individual who is exempt for the reasons I've already identified, it would certainly be an option for them to wear a visor, a face shield, as you know, it's an option. We wouldn't require it, but it would be an option for them if they wished. So we're going to take very much an education and supportive approach with this. There are penalties cited under the Emergency Management Act, and they're actually very substantial in quantity. But in fact, we're going to be taking an education and supportive approach, and speaking with my colleague, the medical officer of health in Wellington, Dufferin, Guelph, Nicola Mercer. She's seen, anecdotally at least, by her observations, of very high degree of compliance with her order, and that has been with no charges laid, and just with an education and supportive approach. We are going to give emphasis to that. In theory, this could be enforced because it's provincial legislation with that Emergency Management Act, it could be enforced by police, by health unit enforcement personnel, as well as by municipal bylaw enforcement officers. So we would have quite a potential base for enforcement, but we've been told that there's very, very limited resources for municipalities or police to be able to do this, and certainly as a health unit we wouldn't have much in the way of resources to be able to enforce. So emphasis is going to be on supporting and educating, and communicating back when needed. So I'm just going to have a look at any further comments or questions. That are outstanding related to all of this. So there's one question here that says, why ask businesses to create a policy? Why not create an order? So they're not mutually exclusive. And in fact, the orders have been to operators of these premises, telling them that they are to require persons within the public settings, indoor public settings, to be wearing a face covering. So in fact, the two go together, and we chose a policy approach because that's what's been emerging more recently with some of the other health units, and because with a policy approach, it really directs the operator of the business to think through going through all the steps required to really make it work. So what do they need to do in the way of training of their employees to make it work? What do they need to do in the way of signage to make it work? And we, in fact, are providing signage for them to use off of our website. What other changes do they need to make to their environment to make it safer beyond just the mask support as well? With a policy approach, they take a more comprehensive approach to it. We're having this commence as of Monday, the 13th of July. So we're giving 6 days for businesses and members of the public to prepare for this. As I said, some health units have made it effective immediately. Some have chosen up to a week. We've chosen to go the latter route. do people still have to physically distance if they wear a mask or face covering? And that would be most definitely yes. The research shows that each of these measures adds a layer of protection, has an additional independent benefit. So physical distancing 2 meters has a very measurable impact, an 85% reduction in the risk, according to a review article published on the 5th of June in The Lancet. And so the addition of the use of a mask is a further increment of benefit beyond that. Hand washing is a further increment of benefit beyond that. So you have to continue doing all of these things. We need all of these things, and we as a health unit need to be following up well with all cases about isolation and contact management. All of that's needed to avoid a resurge from happening. What about people who do not have access to masks or money to buy them? So on our website, we have information about what you can use in the way of a face covering or a mask. That you have a lot of options. It certainly can be something that you make. There's instructions about how you can make a mask, but you can also use a bandana or a niqab or a hijab or other types of face covering. So you do have options. And if we encounter more options for people, we'll put them on our website. If we encounter charities that are willing to give masks, we will certainly make that information available. So there's a question here about shields or visors, and I've already addressed those, that they aren't a substitute for a mask. You need to use the mask visor with it if you wish. Use a visor instead of a mask only if you are exempt and cannot wear a mask. So that takes me to the end of my questions. At this point, I'd be happy to take any questions from yourselves.
Okay, thank you, Dr. Gardner. We'll start with Erica Engel from Collingwood today.
Hi, my question is about enforcement. I know you mentioned that it's more of a policy thing. If you see a need arise, what kind of enforcement can theoretically be done with this order you've issued, and by whom?
So we most definitely are going to give emphasis to education. We don't have personnel at our disposal that can be very actively enforcing on this. I'm sure that we will get public reports that we can then follow up with proprietors about what it takes to do this or do this well. We do know, because we're using the emergency measures, the Emergency Management and Civil Protection Act, that there are other bodies, other enforcement personnel beyond our own public health inspectors who could do this enforcement. So bylaw officers of municipalities can do this kind of enforcement, and police can as well. But I have been informed that they're very busy too, and they're not going to have extra resources to be able to placing a heavy emphasis on enforcement. So it's going to be very limited. It's going to be based more on education, follow-up, and support. In theory, the fines could be anywhere from $750 to $1,000 for individuals to a maximum of $100,000, and for corporations up to $10 million for each day or part of day in which the offense occurs or continues. So we've included that in our letter to the businesses, but I think that that is more just because it's important for full disclosure that they be aware of that. That's not our emphasis.
Have you had any businesses similar to municipal leaders reaching out to ask you for a decision on this, or any feedback on what they need from you when it comes to mask wearing?
So I have been informed through leadership within healthcare in one of our communities that the local Business Improvement Association was interested in this kind of thing because they did not want to have a resurgence and the potential for a loss of their business rights again, losing the ability to maintain an open business. They did not want that to happen, and therefore they wanted this kind of leadership.
Sorry, which municipality was that?
Aurelia.
Thank you, Erica. We'll go on to Dawn Housestone from the Huntsville Doppler.
Thank you. It seems that in some ways this could potentially pit businesses against their customers. I'm sure many businesses will want to do the right thing, as will the people that are coming to visit their establishments. But what would you say to either the businesses or the people that don't see this as a necessary measure and are going to try to circumvent it somehow?
Well, we're all in this together, as they say. We all have to do our part to flatten the curve. We've had success here, and we want to maintain our success. We don't want to go back to a lockdown of some kind in the future. All of us are concerned about the potential for a second wave now or in the fall. We need to implement what we can to avoid that. We need to do it together. This has been an exercise all along of working together to achieve what we've been able to achieve. In areas where they haven't been able to work together, or the leadership has not been there to make sure that happens, then they end up with a resurgence again, and they end up with unnecessary disease, death, and potential loss of business, closure of businesses again as they're forced into a lockdown again. So we really need everybody doing their part on this, including businesses, including those that are opposed. I certainly would welcome any communication to the health unit about your concerns, and we can walk through them. I certainly would be open to dialogue. I've received some of the submitted research for dialogue. We certainly welcome that. This is a learning process for us. This virus has only been around for just over 6 months, so we still have a lot to learn about it. But at the end of the day, we need to work together.
And if a second wave were to hit despite these measures, would having something like this in place be enough to say we can continue to have businesses open, or would we have to step back again despite having this mask use in place?
If we were to have a resurgence, and if it were substantial, we of course would have to take additional action. If it were localized, we'd have to look at what's happening locally that needs to be addressed. If it's like workplaces, are there specific things happening there that need to be corrected? If it were people not abiding by the limitation on gatherings or social circles, we'd have to look at how do you promote fixing that. If it's happening in public settings like businesses, well, then we'd have to look at that. We'd have to look at whether or not this approach was actually achieving having high compliance with mask use, and if there are other things happening as well. If it were to happen widespread across the province in a very large way, I think the political leadership would then be needed at a provincial level as to whether or not we needed to put in place some of the bigger measures again, such as closing certain types of businesses or certain types of gatherings. Hopefully we won't have to go there, and I think that the whole point of adding this additional measure is to help avoid that from happening.
Thank you.
You're welcome.
Okay, thank you. Nathan Schubert from the Moose FM.
Good afternoon, Dr. Gardner. How are you doing?
I'm doing well. How are you?
Very well, thank you. I just wanted to ask you something. Earlier you mentioned you're going to be taking a softer approach. Do you feel that this is the best option and doing kind of this educational approach rather than slapping on fines? Do you feel that this would really help get the message across, or do you feel that there should be a more stricter way to really enforce this?
Well, it's very typical of public health to take the softer progressive approach and take an educational approach, even in other areas where we do enforcement, long-standing areas of enforcement, such as on food safety with restaurants, for example, or other food establishments. We take an education approach and a coaching approach and move to sanctions when necessary. But I've seen in communicating with colleagues that this approach has worked in at least one other jurisdiction. So it's natural for us to take this approach to begin with. It's worked in one other jurisdiction. We can progress with a harder approach if we have to, both with this letter that I've issued now, or with possibly issuing changes to that direction in the future if needed. So I think in my mind, most people want to do the right thing, and they want to comply, and they want to work together to address this problem. And if there's leadership that helps everybody to work together, they want to comply with that. And I'd much rather work in that way with the best effort approach for businesses and organizations, and in good faith.
At what point would bylaw officers start administering those several $100 fines up to $1,000 that you mentioned earlier?
Well, for one, I can't guarantee that bylaw officers would do that. I don't have direct control over that. They're empowered to do it, but I don't have direct control over that myself. I think they'd be looking for us, though, to be advising on that kind of thing. And I would just say that we wouldn't rush to it, that's for sure. It would be a progressive educational approach.
Thank you.
You're welcome.
Okay, thank you. Dana Goldfinger from Global News.
Hi, sorry, I think everything was answered for me in the last couple questions. Thank you, though.
You're welcome.
Okay. Don McNeil from MyFM. You're not with us, Don? Okay. We'll go down to Craig Momney from CTV. Barry?
All my questions were answered. Thank you.
Perfect. Okay. Ian McLennan from Barry 360.
Just to this policy that's in place, does it include places of worship as well? And specifically, when we talk government buildings, is it federal, provincial, and municipal?
Yes to all of the above. We wanted to be inclusive about it. We had to think through very carefully what would you exclude. Places of worship can be areas of transmission. People's worship is very important to them, important to their well-being, their health, their spiritual well-being. But if we're not careful, they can also be places where transmission happens. People, before the pandemic, could be closely confined with each other in such places. We know that singing, for example, can cause exposure of people to droplets. I'm sorry, I'm hearing some background noise. If people could mute, that would be great. Thank you. So singing can be hazardous. We've seen some outbreaks documented and published associated with singing. People in close confinement with each other can be problematic, and so there are guidelines for conducting faith-based services that help to address these things, and so certainly mask use was encouraged in them, and now it'll be required to help protect vulnerable people in those settings. And there can be vulnerable people, members of the public, in provincial and federal facilities as well.
And finally, Dr. Gardner, is there an end date to this policy? Because some jurisdictions have implemented an end date, or is this going to continue until you declare otherwise?
So you raise a really good point. I meant to include that this would only be empowered during the state of emergency provincially. And so when that state of emergency is declared over, this would no longer hold, would no longer be enforceable. So that would be one way in which it could come to an end. Another way in which it could come to an end is if I rescind it or I change it. But at this point, it doesn't otherwise have an end date.
Okay, thank you.
You're welcome.
Thank you. We'll move on to James Buller from Coachco.
Yes, hi, thank you. Dr. Gardner, I feel like you sort of identified this, but I wanted to clarify. So this is kind of a base model. Are you allowing, or would you allow municipalities to build on this with their own bylaws decision?
Thank you for that question. And in fact, in my letter to the CAOs, I indicated that if they wanted to, they would have the right to create a bylaw that could be in support of this direction, and that we could be a resource to them with that if they wished. It would have certain advantages. I think it would signal support from the municipality, and it could persist after the declaration of an emergency provincially was rescinded, and it possibly could have other benefits that I can't really foresee at this point. So we would be happy to work with municipalities if they wish to do that. And that has been done in other instances where medical officers of health have issued orders. They've seen municipalities put in place bylaws in support.
My other question is moving away from the masks. A couple of months ago, I had started a conversation about reporting out of area infections in this area where people would go back home. They weren't reported in our health unit. I just wanted to follow up on that again because I know there's been calls from medical professionals saying that these numbers really should be reported in our health units because it's not really identifying that there is an issue. People are having a false sense of security, not seeing these infections, even though those infected are going home to recover, they became infected, say, here in Muskoka. So I'm just wondering if the health unit might possibly move forward with actually identifying those numbers as well.
So we've certainly identified those numbers as best we can when asked on a one-by-one basis. And we do that with all outbreaks that are in our district as well. So institutional outbreaks or workplace outbreaks, when I verbally report, I indicate how many cases are associated with that and how many live here and how many don't live here, and then indicate that our numbers capture only those who live here. So I try to give a broader sense of it. But if I understand you, if I understand you, you would actually like it tabled in some way up on our website, that we include that count on an ongoing basis.
Yeah, I think that would be easier for people to realize that there are still infections in the area, just not Muskokans or Simcoeans or whatever.
Yeah, that they may have contracted it here and then went elsewhere, for example. Yeah. If that's what you're referring to, yeah. I mean, that's the kind of thing that might very well happen with public crowding at attractions or beaches, where you get large numbers of people from elsewhere. Potentially they could become infected because of that exposure, and they go home and they become a case home, and yet the transmission happened here. If we had a way of noting that and reporting that, that could be helpful. I agree that would be helpful. I don't think we're always going to be able to figure that out, however. Yeah, can't guarantee it. I'll go over it with my staff. There are always technical issues related to such things, but I will go over it with them.
Thank you.
Okay, Andrew Medler from Simcoe.com.
No questions. Everything I had was addressed already. Thanks.
You're welcome.
Okay. And Elizabeth Smith from Rogers.
Yes, thank you. Hi, Dr. Gardner.
Hello.
So just to clarify, for the public out there, I'm hoping that you can clarify for us, does required mean mandatory?
Well, I think everything comes down to definitions. The requirement or mandatory requirement is actually directed to the operator of these premises. But for them, they would be requiring that attendants use a mask. We've taken a softer approach where we said that they are to take a best effort approach with this, and that we don't actually require them to exclude people. If they encounter people who absolutely refuse to wear a mask, we're not saying they absolutely must exclude them. They could if they wish, and then certainly there are businesses that have made it a policy to require people to wear masks, and they enforce it. But we're taking a moderate approach in this.
Okay, thank you for that. That was great. My next question is, do you think that masks need to be provided for free? I know this is in the early stages, for free, so people aren't barred from business transit for not having access?
Thank you for that question. The TDC in Toronto is making masks available free. I've encountered businesses that make masks free. I think it would be a facilitator of all of this. It'd probably be good for businesses early on as people start to catch on to this to allow them to come in. But in fact, in our direction, we've not mandated that they must do this. So bottom line, it would probably help, but we're not actually requiring it.
Okay, thank you.
You're welcome.
Okay, thank you. Is there anyone else on the line who we haven't spoken to yet?
Doug Cross here.
Doug, go ahead, Doug, please, from Muskoka region.
Thank you. So the restaurant sector has been hit particularly hard. Granted, there's been some patios, etc. Some U.S. jurisdictions are allowing people to wear masks to a restaurant for indoor dining, get seated, then they can remove the mask for mealtime, but they must wear it anytime they transit in the restaurant. Can you foresee any type of a modified approach of the mask policy to help indoor dining? Because warm weather only lasts so long, and then we could be back into indoors again.
Yeah, very good point. And in fact, I'm sure the restaurant sector would also benefit greatly from increasing the size of the service area that they could provide to increase their business. So that'd be another reason why they would want to do that, I'm sure. And you raised another point that I meant to get into. Our my direction, applies to indoor settings, not outdoors. And so right now it would not apply to the patios of restaurants. I would encourage that service providers, waiters, waitresses, wear a mask when they provide service to people at their tables because they come in close contact with them, but we're not actually requiring that, at least not at this time. And right now the province has prohibited restaurants from operating indoors. So it would be up to the province to change that, upcoming with stage 3 whenever that happens. When that does happen, our direction would apply for indoor settings. However, there's another exemption, and that is that people can remove their mask to do something that is essential. It's essential to not have a mask in place when you're doing that. So eating and drinking, or swimming, or doing intense physical activity where you're sweating a lot and breathing heavily, they would be able to not wear their mask during those times, their face coverings during those times. So the day in which the province allows people to dine indoors, we would be allowing people not to wear a mask when they're in fact dining.
All right, excellent. Thanks for your time.
Be important to note that the waiter then, or waitress or tenant, would have to wear a mask while attending to them indoors.
Okay, was there anybody else that we missed before we call this our press conference over?
I actually had a couple more questions. It's Erica, so I'm calling you today.
Okay.
I just wondered if there was age exemptions for kids.
Yes. Below the age of 2, we recommend that they not wear a mask. For those between 2 and 5, if they have trouble with it, that they not wear it. And then beyond that, anyone who has some kind of a medical issue that would preclude them from wearing a mask, as well as religious reasons. And then it also cited the activities that would preclude it, such as eating, drinking, swimming, heavy physical activity.
Okay, and this order does not require wait staff to wear a mask if they're serving outdoors?
It does not, though I heavily encourage it. And if we get to the point that they're allowed to serve indoors, they would have to wear it.
Okay, thank you very much.
You're welcome.
Okay, that seems to be all our questions for today, Dr. Gardner. Thank you all very much for joining us.
Thank you, everybody. Goodbye.